today we'd like to talk about relationship between PCOS and recurrent miscarriage as well. Known PCOS is caused by presence of abnormal testicular tissue that is not supposed to be, that this woman end up being born with it, and over time when they develop during their puberty and they experience high testosterone level and up developing physical symptoms such as excessive facial and body acne that doesn't go away, and also excessive body hair, obesity, raw and dark skin, and also we end up developing some form of emotional instability, all tied into the high testosterone level as well. So another thing that women experience is that if they do end up getting married and then the beginning pregnancy is that will be experience pregnant failure on repeat, because although they have no getting trouble pregnant, there is no infertility. Here it will lead to very short-term pregnancies because first of all, these follicles that are released from ovaries are not well developed, causing them to break down very quickly and also cause several abnormalities within the deceased fetus as well. Wherever we do some post miscarriages analysis, we will find out some form of chromosomal abnormalities such as trisomy, some abnormality that is clearly linked to the PCOS, which is why you need to seek treatment. Furthermore, this PCOS patient, 50% of them are actually having another underlying condition alongside this PCOS, which is uterine malformation. So the common ones that we observe are septate uterus and naive uterus. Naive uterus, some of them even develop cervical insufficient as well known. These two conditions are tied into together, which is why true diagnosis is required to treat both individual condition. So even your managed sustain of pregnancy because of the presence of septate and naive uterus, it will lead to another short term of pregnancy as well, and has a chance to lead to an ectopic pregnancy as well, which can lead to complications such as removal of fallopian tube as well, and that is something that we want to avoid, because now it become condition where still are able to get pregnant and up becoming absolutely infertile because of the removal of fallopian tube. These are why possible, and we deem there as high risk pregnancy. So at Antai Hospital, we do offer the highly effective true comprehensive diagnosis treatment for underlying condition that has lead to miscarriages.